Hi again, everyone. For the first time this year, I'm attending Goalkeepers, not just as a co-chair of the Bill and Melinda Gates Foundation, but also as Nona. That means grandma. Because in February, my daughter Jen gave birth to a daughter of her own. And the last 6 months have filled us with a huge sense of joy and gratitude. Because I don't take any part of that birth process for granted. I've met too many families like the ones we just saw in that incredibly moving video. You know, families who were anticipating a new child, a sibling, a grandchild, and instead they found themselves mourning a daughter, a mother, a partner. Statistically, the day a woman gives birth is the most likely day she is to die. And for every woman who loses her life in pregnancy or childbirth, 30 more face long-term consequences, things like heart failure or stroke, depression, and as well their economic consequences, missed paychecks, lost businesses. Today, the most common cause of childbirth complications like postpartum hemorrhage and infection are largely treatable. But actually getting those treatments too often depends on where you live. Women in 2 regions of the world, Africa and Southeast Asia, bear the brunt of this burden. They account for nearly 90% of maternal deaths. That is more than 250,000 women dying every single year. It's enough to fill a World Cup stadium 4 times over. For women in other parts of the world, the risk often depends on not who you are, but where you live. In the US, our maternal mortality rate is far worse than any other high-income country. Get this, American women are 10 times more likely to die in childbirth than a woman who lives in Australia or Israel or Japan or Spain. The biggest maternal mortality crisis in our country is with Black and Indigenous women. They are 3 times more likely to die than a white woman in our country. That's true whether you account for anything like education or even income. Now, of course, these disparities are not limited to the US or just to maternal mortality. From HIV/AIDS to healthcare screenings, we're seeing widening health gaps and declining prospects for women all over the globe. Let's think about some of the numbers. Cervical cancer. It's one of the most common cancers for women. It affects hundreds of thousands of women every single year. In 2020, 90% of cervical cancer deaths took place where? Low and middle income countries. 90%. Now, we've known how to prevent cervical cancer since 2006. It's a vaccine, called it for HPV. And you might think we'd done a great job at distributing these powerful life-saving vaccines to the girls and the young women who need them most. But we're not. In low-income countries, only about 10% of girls are fully vaccinated. In many of the high-income countries, about 90% of girls are vaccinated. More than 250 million, that is 250 million women, are asking us for something else, and that's modern contraception. Those women are mostly in low-income countries, and what they're telling us is they don't have access, and they know about these tools. That means that every 1 in 4 women who wants access to contraception globally still cannot get it. And in sub-Saharan Africa, that number is 1 in 2. That means for a woman, it's a coin flip, whether she's going to have the power to plan her future. So this reality, it can be really hard to stomach. But as the video reminded us, it just doesn't have to be this way. Investing in women's health, and in particular in high-quality, affordable, equitable health care, is one of the surest ways to build the better future we all imagine. Because this isn't just about being physically healthy, it's so much bigger than that. Women cannot do well unless they can be well. And if we're healthy, if we're not fighting off disease or recovering from childbirth complications, we're better able to focus on our studies or to start a business or lead in our own communities. That is the direct line between a woman's health and her economic power. And that's what we're going to explore during this session.